now we're going to work on how to take an x-ray. We're actually going to take two kinds of x-rays today. First we're going to take a Panorex, and then we're going to take a Ceph. So once you're in the patient's chart, you're going to come up here to single import. Then we're going to pick a time point, which means we're going to pick what kind of appointment and the date, basically. So this would be a progress appointment. So you click on progress, making sure that your date matches today. And the type of image that you're going to take, what type of x-ray we're going to take, we're taking a Panorex. And it's always Panorex 1 for this setup. So that all looks good. So now we're going to hit scan. Let the machine pull up a few things. We want to make sure that the image that we're going to take matches the actual x-ray that we're going to take. So this is the pan, so it's all set to go. Then we're going to hit this purple arrow down here. And it's going to say, make sure you move all the parts. So you hit OK. Sounds good. The machine's going to move all around. So you just want to make sure your patient is out of the way so they don't get bonked in the head. Let it do its thing, and then we'll click a few more buttons. All right, I wanted to show you a couple things before we actually put our patient in the machine. On this little bite stick right here, there's a little bit of a groove kind of on the top and the bottom of that bite stick. And so that's where your patient's going to come in. They're going to rest their chin on this chin rest, and they're actually going to bite down on that little bite stick, placing their front and centrals, top and bottom, in that groove. And then once they're all set up in that machine, we're going to kind of close these head clamps on there, and then we're going to push a few more buttons and we'll get things going. All right, now that we have our patient, we're going to tell them, you're going to rest your chin on here, and there's a groove on the top and the bottom of that stick. You're going to step forward and bite on the edge of that stick for me. So there they go. And you can raise this stick, so bite down, yep. And we're going to lower their chin down. There's a little lever right here that moves that stick up and down. So once they're biting together, we want to make sure that the right underneath their eye and the middle of their ear is level or parallel to the floor. So we don't want their chin too far down or too far up. So now that we have that, we're going to just gently close those little clamps. And I like to tell my patient, stay biting on that stick. Close your lips down like a straw. Yep, may I have your hands, please? There's handlebars for right here. Thank you so much. You just stay biting and hold really still. It's just going to go around you and make a little bit of noise. Now that the patient's in there, hit this go arrow, and it's going to tell you, go for pushing the button. So come on over here. We're going to hold down this button until it stops beeping. Fabulous. Now we can come around here. You did a great job. If you would just step back and pull that little plastic baggie right off of that strip for me. Thank you so much. You can toss it right here in this garbage. Fantastic work. Then once you have taken your patient out of there, there's a little blue arrow right here on the screen. We're going to hit that blue arrow, which then sends it over to the Edge software. So then you can close out of the X-ray software. It's going to upload it to your screen, and then you need to save it or import it. So you hit this little save button, or you could hit this import button. It's the same thing. And then it'll tell you that it saved it successfully. And then we can move on to our next one. We're going to work on taking a Ceph x-ray. So once we're in the patient's chart, we're going to come up here to single import. Then we're going to decide what kind of x-ray and the date of the x-ray. So today's going to be a progress appointment. So we're going to come down to progress, making sure that that date matches today's date. And then the type of x-ray that we want to take is called a lateral Ceph. So we're going to scroll up till we find that lateral Ceph. And we're going to click on that, and then we're going to hit scan. Then the x-ray software pulls up, and this image does not match the image that we're trying to take. This is a Panorex. What we want to take is a Ceph. So if you look right here, we're going to actually click on this button, and it'll pull up the Ceph image. You can see how it moved that dot, which then trimmed off part of that image. So we want to make sure that we move that image, or that dot, back so it takes a whole image of the whole head. Then we're going to hit this arrow, which will then kickstart the machine to actually spin around and get set up. We need to move what we like to call the brain of the x-ray machine. So we're actually going to just kind of tip this back, which will then pop this piece out. Then we're going to walk it over here, and there's two little bars that match up with these two bars. So you set it in there and then just give it a good push on the top, and it'll lock it in place. Now that we have moved the brain of the machine, we're actually going to hit this arrow again to tell the machine to keep setting up, to keep spinning around, letting it do its thing. So once the machine has all set up and it's ready to go, it'll actually tell you to actually put your patient in that position. So we have one more thing to do. This unit right here actually lifts straight off. because there's an image, it actually shoots that image, and this would actually block part of that step. So we want to make sure that we take this off as well. All right, now that we have our patient, we're going to position them so that these little ear pieces will rest gently in their ears, not too far because we don't want to hurt our patient, but just have them step forward so they line up. And all you have to do is squeeze them together. Tell your patient to line up, checking both sides kind of simultaneously. Then I'm going to have that patient, let me see, bite together. Again, we're going to keep this eye socket and this ear line parallel to the floor, okay? So then we have a nose piece as well, which comes down. We're going to rest it right on the bridge of their nose, kind of where their forehead meets their nose, right between their eyes. So we're going to tell our patient, just bite normal on your back teeth, stay biting together, close your lips, and hold really still. Now that that patient's ready, we're going to click that arrow again. Again, here's that button that tells us we're ready to go, and we're just going to hold this down till it stops beeping. We're going to get that patient out of there. So we're going to slide this forward, kick it to the side, and then just gently push these apart and have our patient just gently, slowly come out of there. Fabulous. Now to save this image, we're going to click on this blue arrow for the X-ray software, which will then send it over to our Edge software so we can close out of this one. Just letting it upload. And there's our image. So now we need to save it. So we'll come in here, we'll hit import, or you can hit this little save disk right there. It does the same thing. And there it is, successfully in their chart. Now that we're done taking x-rays, any sort of x-ray, whether it's pan or a ceph, we want to make sure that we wipe down that machine for our next patient. Take a glove, one cavi wipe. Come on over here. So if you did take a ceph, we want to make sure that we clean off those earpieces so that there's no residual wax or anything like that. Even that little nose piece, there could be makeup on there and all that kind of stuff. For the pan machine, we want to make sure that we wipe these handles because their hands did touch them. Any buttons. Make sure we're wiping down this chin piece. There was a plastic baggie on this little bite stick, but just to be sure, we always want to make sure that we wipe that. And then also these pieces that touch their head as well. So anything that that patient touched, just make sure it's nice and clean.